Nurses' critical thinking skills and clinical judgment. Do you think that there's a relationship? Hi everyone, I'm just sharing to you a research study that I conducted during my postgraduate study, and the title is Relationship Between Nurses' Critical Thinking Skills and Clinical Judgment. In theory, critical thinking skills should always direct nurses' day-to-day clinical judgment in order to make sound clinical decisions. However, the association between the two in the actual clinical setting is yet to be established. This descriptive correlational study investigated the relationship between nurses' critical thinking skills and clinical judgment among 71 registered nurses chosen through stratified random sampling technique from a tertiary healthcare facility. A demographic questionnaire, nursing critical thinking skills assessment test, and clinical decision making in nursing scale were employed to gather data from the respondents. The data were analyzed using Pearson correlation coefficient through SPSS software. There are three confounders identified in this study, namely length of experience, area of exposure, and exposure to workplace intimidation. Results indicated that there's a significant positive correlation between nurses' critical thinking skills and clinical judgment. Confounders such as area of exposure have significant correlation on both critical thinking skills and clinical judgment. This means that nurses who are working in a complex and specialized unit requiring constant utilization of their critical thinking skills, such as in the case of ICU and ER nurses, are observed to have better clinical judgment and critical thinking skills. In addition, workplace intimidation have significant correlation with clinical judgment. The findings suggest that those nurses who are exposed to workplace intimidation, such as in the case of bullying, demonstrate poorer clinical judgment. This study recommends staff to undergo continuing education, more in-service critical thinking session through case study analysis, and zero tolerance to workplace intimidation and bullying. To my fellow nurses out there, do you agree with the results? Type on the comment section. Thank you.